Hello, my name is Katherine Harvey. I am a registered dental hygienist and myofunctional therapist at Rifle Dental Care, and I'm here to talk to you about sleep apnea today. I hope you enjoy the presentation. Sleep apnea is a common and serious sleep disorder that causes cessation of breathing during sleep. Sleep apnea can make people wake up in the morning feeling unrefreshed and still tired even after a full night of sleep. During the day, many sufferers experience a lack of concentration, daytime drowsiness, low energy levels, and lack of motivation. The most common symptoms of sleep apnea is snoring. However, much to contrary belief, a person does not have to snore to be diagnosed with sleep apnea. Common symptoms of sleep apnea include loud or frequent snoring, silent pauses in breathing, choking or gasping sounds, daytime sleepiness or fatigue, unrefreshed sleep, insomnia, morning headaches, nocturia, which is frequent nighttime potty breaks, difficulty concentrating, memory loss, decreased sexual desire, irritability, grinding, sleep terrors, sleep talking, restless sleep or weird positions, and bedwetting. Sleep apnea does not discriminate. It affects all ages. Some of the risk factors are excess weight, neck circumference of 17 inches or greater for males, 16 inches or greater for females, your anatomy. You may have inherited a narrow throat. Tonsils or adenoids also can enlarge and block the airway, particularly in children. Men are 2 to 3 times more likely to have sleep apnea than women. However, the risk for women increases with being overweight and after menopause. Your age. Sleep apnea occurs significantly more in older adults. Your family history. Family members with sleep apnea might increase your risk. The use of alcohol, sedatives, or tranquilizers. These substances relax the muscles in your throat, which can worsen obstructive sleep apnea. Smoking. Smokers are 3 times more likely to have obstructive sleep apnea than are people who never smoked, due to increased inflammation and fluid retention in the upper airway. Nasal congestion. If you have difficulty breathing through your nose, whether from an anatomical problem, allergies, or oral breathing, you are more likely to develop obstructive sleep apnea. Alarmingly, the numbers of children with sleep apnea are on the rise. Unlike an adult, there are no universally accepted guidelines as to when a child's sleep apnea is severe enough to warrant treatment. Since children rarely experience sleep apnea events, most sleep specialists considered 1 sleep disturbance per hour as abnormal. Let's face it, children are growing and developing. Not only do they need quality sleep, but they also need continuous oxygen to the brain. Many children who are diagnosed with ADD and ADHD have sleep apnea. It's possible that the behavioral issue associated with ADD and ADHD might simply be a child who isn't sleeping well. As cute as we like to think it is when our young ones snore, it could be harmful. Ruling out sleep apnea is most important. After that, evaluation for myofunctional dysfunction is important. The body and brain need oxygen. When there is a lack of oxygen, negative long-term consequences can be profound. Sleep apnea is a serious medical condition and left untreated can have serious fatal consequences. Complications can include stroke, heart disease, high blood pressure, prediabetes and type 2 diabetes, metabolic syndrome, depression and anxiety, liver problems, complications with medications and surgery, sleep-deprived partners, hyperactivity and behavioral issues, cognitive problems, and growth issues. Here we see a picture of normal breathing with airflow going from the nose down through the throat. The second picture is snoring, where there's partial obstruction of the airway with the soft palate and uvula partially collapsed. And then this third picture is obstructive sleep apnea, where there is a complete obstruction of the airway, where the uvula and palate have completely blocked off the airway. A sleep medicine physician can diagnose sleep apnea with a sleep study called a polysomnogram. This evaluation monitors the heart, brain, and lung activity, blood oxygen saturation levels, and limb movements. A polysomnogram will help the doctor diagnose central sleep apnea, obstructive sleep apnea, narcolepsy, and many other different types of sleep disorders. Some doctors will start with a home sleep screening test as well. It is a great screening tool and is much more affordable for the first step, but there are limitations. A home sleep test does not measure brain waves, sleep time, and leg movements, and can underestimate the severity of sleep apnea when compared to a lab-based sleep study. CPAP, continuous positive airway pressure, the gold standard of care, is a device that gently blows air into the airway to keep it open during sleep. A BiPAP, also known as a VPAP, variable positive airway pressure machine, is similar to a CPAP, but the airflow changes with inhalation and exhalation. Oral appliance therapy, the appliances reposition the lower jaw by bringing it forward, as well as the tongue to remove obstructions. Surgeries such as tonsillectomies, adenoidectomies, nasal, UPPP, maxillomandibular advancement, somnoplasty, hypoglossal nerve stimulation, lifestyle changes, losing weight, avoiding alcohol, narcotic pain pills, sedatives, and tranquilizers, changing sleep positions, and stopping smoking. At Rifle Dental Care, Dr. Capelli can help you or someone you know suffering from sleep apnea by providing a sleep health questionnaire and evaluation, coordinating an at-home sleep study or referral to a sleep specialist, and providing oral appliances to open airway and improve or eliminate sleep apnea. Quality sleep plays a vital role in overall wellness. Sleep has a multitude of benefits such as improving immune function, helps control body weight, protects mental health, regulates appetite, maintains a healthy gut microbiome, enhances memory, better choices, improves concentration, increases productivity, maximizes athletic performance, decreases cardiac risk, decreases diabetes risk, and decreases inflammation. Thank you for joining me today as we learn more about sleep apnea. I hope you found this information helpful, and if you have any questions or concerns, please contact our office. We are here to help you achieve optimal health.